Person-centred care, I think, is the very basics, the very fundamentals of nursing, of healthcare. It means putting the person and everything that's dear and meaningful to them at the centre of the core of their health, of their care.
To me, person-centred care is about a method of care which is involving the whole person, which is concentrating on them, what they really want out of life.
It means everything. It is such an interesting question, the one about patient care, because indeed that's the final goal of all of us as health professionals. And in this sense, we are now working hard internationally with organizations like the Leg Club, the Venous and Lymphatics Ward International Network Foundation, where we actually had now coming out a document dedicated to guidelines from all around the world so that we can start treating people with the same recommendations rather than having different recommendations around the world.
I don't want that every person who comes to me for a consultation, he's not a patient, he's not sick, he's a person, and he says what he wants from me, what can I help?
Person-centered care is a big aspect in wound management, and it's a very comprehensive type of management. So it's not only dressing and bandaging, but also psychosocial aspect, after clinic type of activities. This is why a leg club concept is something working very well.
The huge benefits are the social interaction, the reduction of social isolation and seeing people that actually have a similar condition to you and who have managed that and learning from that.
And I think from a healthcare professional point of view, you go into one place of work and you could be seeing 40 patients all at once. There is a general feel of camaraderie. Everybody's in it for the best for that patient, and it's regardless, irrespective of what background you come from, whether you're a nurse, a physio, an auxiliary, a helper, a volunteer, you actually don't know who anybody is because you're all there to do the same thing, which is to get the best for that patient at that time.
I'm sure that the Leg Club model helps to improve concordance, particularly through association with other members or patients. They see things that work and they can share problems, but they share understandings.
There's been lots of evidence about recurrence being in some way related to social isolation, that people forget the reasons that their wounds sort of healed. They didn't, they stopped using their support hosiery over time because they've forgotten. I think one of the great things about attending a leg club is that you can continue to attend when you've healed, so you tend to then continue to concord with the advice that's been given. I think where you're isolated and alone at home, you often forget what that advice was. It's not reinforced regularly, so you don't wear your stockings, you break down again and the cycle begins. I think within a social setting that you can continue to attend, you remember the messages.
The Leg Club model does enable patients to stick with a plan and see it through, because leg clubs make it as easy as possible to get there by way of the times that they run. It's not a fixed appointment, it's a window of time that they're able to get. Many offer minibus collections and things like that, so patients are able to get there. But I also think because of the situation they're in and they're coming to a club and it's a social setting, they want to come. For some, it's the only time they get out. Many run quizzes or raffles, and so it's a real social situation. They have a cup of tea and a biscuit, and I think from that side that they want to come, and so therefore they're more likely to see the end of their treatment.
I think the thing with the charity is we all know that it's independent. It's not necessarily there to make a profit. It's actually there to support the people that come to us, or members that come to us, to support them in their clinical care, but also social care. And I think therefore, This is something that's been running for a long, long time. The proof is out there in terms of the outcomes from the leg clubs. And yes, I think people can feel very comfortable that the money that is being generated, if there is any, is being put straight back into that care.
I think a charity being involved is a really good idea. People see it for what it is, and it's very patient-centred or member-centred in the case of the leg clubs. So are very supportive of it and understand from probably where they've started from to what they're trying to achieve. But they can see the difference it's making to the patients or stroke members if it's the leg club, not just from a medical perspective but from a social side as well.
Two of our core beliefs and behaviours are care and collaborate. And I think the leg club model really epitomises that. The leg club model works perfectly within the current way of working in the NHS, a great social care model, and I think it's extremely caring and also a great place for patients, caregivers and also family to collaborate.